COPD is diagnosed based upon a variety of factors and assessments. Your doctor will assess your symptoms, your medical and family history, and review your exposure to lung irritants. Your doctor may have recommended some tests to help diagnose COPD and exclude other possible conditions that could be causing your symptoms. Once they have excluded these other possible conditions, COPD is diagnosed with breathing tests of your lung function. Lung function tests measure how much air you can breathe in and out, how fast you can expel the air, and how well your lungs deliver oxygen to your blood. The main diagnostic test for COPD is called spirometry. This is the breathing test that measures how much air you can blow out and how fast you can blow it out. The results help us diagnose COPD and determine its severity, or if another condition may be causing your symptoms. Your doctor may measure the levels of oxygen and carbon dioxide in your blood to determine whether you need oxygen therapy because your oxygen levels are low. This is done through a blood test. People with COPD typically show lower levels of oxygen and higher levels of carbon dioxide. This is because people with COPD have difficulty getting oxygen in and expelling the carbon dioxide from their lungs. The results from this blood test can help in evaluating the severity of your COPD. Your doctor may also request a chest X-ray or a CT scan of your chest. These tests create a picture of the structures inside of your chest and can tell us if your heart, lungs, or blood vessels show signs of COPD. These pictures are also useful in determining if your symptoms may be caused by another condition. When you've been diagnosed with COPD, it's important that we work together to help prevent further complications and to help slow the progression of your disease. If you smoke, the first and most important step you can take is to quit smoking. Smoking is the leading cause of COPD in the United States. Most of the damage to your lungs is caused by the continuous cycle of inflammation brought on by smoking. The health benefits from quitting smoking are immediate and long-lasting. 8 hours after quitting, the carbon monoxide level in your blood drops and the oxygen level in your blood increases. Just 48 hours later, nerve endings start to regrow and a sense of smell and taste begin to return. Circulation, coughing, and shortness of breath all improve within that first smoke-free year. 10 years after quitting, the risk of developing lung cancer is about half of the risk of a person who still smokes 1 pack a day. Quitting now can help you be healthier overall and help you meet the challenges of COPD. We will work with you to find the best smoking cessation plan and support for your situation.
Take as many steps to stay healthy and active as you can. In the upcoming chapter, you will hear from a patient with COPD about the importance of exercise and diet to help reduce symptoms. However, it is important to consult with your doctor before starting an exercise program. Although there's no cure for COPD, there are treatment options that can help manage the disease. Through a combination of medication and self-care techniques, we can work together to help make the difference in your breathing and keep your disease from progressing. We may recommend one or more of the following non-medical COPD treatment options. Pulmonary rehabilitation is a structured program that can help reduce the symptoms of COPD. Depending on your needs, a pulmonary rehabilitation program might include exercise training, nutrition counseling, and education on special breathing techniques, and other means of coping with COPD. We can discuss if this program is right for you. Regular exercise can increase your energy levels, improve your circulation, reduce symptoms, and increase your endurance. We can work together to determine how much physical activity and what kinds of activities are best for you. These might be stretching exercises, an aerobic exercise like walking, or other exercise aimed at strengthening your muscles. Oxygen therapy is another treatment option for people whose COPD is very severe. Oxygen therapy may improve exercise endurance. Surgery may be another option for some people with very severe COPD. In addition to these non-medical treatments, your doctor may recommend one or the more following medications to help make your breathing easier. Two primary medications frequently used to treat COPD are bronchodilators and inhaled corticosteroids. Bronchodilators work by relaxing the muscles around your airways. This allows more air in and out of your lungs and improves breathing. Short-acting bronchodilators usually only used for sudden COPD symptoms. Long-acting bronchodilators are prescribed for everyday use, depending on the severity of your COPD. Your doctor may prescribe both a short and long-acting bronchodilator. These medications are taken using an inhaler, which allows medication to go directly into your lungs. Some side effects from short and long-acting bronchodilators may include a nervous or shaky feeling, overexcitement or hyperactivity, and an increased heart rate. If a patient has severe COPD symptoms, your doctor will prescribe an inhaled corticosteroid with a long-acting bronchodilator. When used correctly, inhaled steroids are breathed into the lungs and may help reduce inflammation or swelling that's an underlying cause of COPD symptoms that can make it difficult to breathe. We may test inhaled steroids use with a bronchodilator for about 6 weeks to 3 months to see if it helps you breathe better. You should know that there are different types of steroids with some important differences between them. Inhaled corticosteroids are breathed into the lungs and reduce inflammation in the airways. Side effects from inhaled corticosteroids may include bruising, oral infections, and hoarseness. The pill form, like prednisone, are taken orally and reduce inflammation throughout the entire body. Oral steroids can have serious side effects such as weight gain, diabetes, osteoporosis, cataracts, and an increased risk of an infection. Colds, the flu, and other respiratory infections can cause problems for people with COPD, so it's important that you do your best to avoid them. Because the flu shots can reduce your risk of getting the flu, and the pneumococcal vaccination can lower your risk of pneumococcal pneumonia and its complication, your doctor may recommend that you get vaccinated.